Hello, and welcome to the Charlotte Maternal and Child Health Workgroup's Crucial Conversation Series. My name is Dr. Lorenzo Hopper, and I'm an assistant professor in the Department of Epidemiology and Community Health at UNC Charlotte. We are so happy to have you all joining us today. We have a very special conversation today entitled Roots and Wings: How Caring Adults Shape Infant and Toddler Mental Health. Now, before I introduce our guest speaker for this conversation, I would like to welcome our first time guests. I'll share more about the work group following the presentation and the Q&A, but this work group in this Crucial Conversation series is an effort that we created to foster collaborative efforts to strengthen maternal and child health work, to benefit our community, to learn more about all the awesome work that's going on in our community, and to build some relationships. So, without further ado, I would like to introduce you to today's speaker, Ellen McNeil. She is a registered play therapist, and she's going to tell you more about herself and what she does. So, I'll go ahead and stop sharing my screen and turn it over to you, Ellen. Thank you so much for being here today.
Yeah, it's my pleasure. Thank you so much for inviting me to be a part of the working group. I've been um, in the conversation about infant and toddler well-being and health overall in Charlotte for a few years now. And so anytime I get the chance to connect with other like-minded professionals is very exciting for me. So I appreciate the opportunity very much. So let me see that I will tell everybody, and you're going to hear this in the recording. Okay. I'll just put it out there for everybody. I am not nervous about talking about infant and toddler mental health. I am nervous about Google Slides. All right. I gave it my best, you guys. We will see what happens. But Google Slides and I have had some disagreements, maybe I'd say. So thank you for your patience with that. And please do, of course, let us know in the chat if there's any issue with, not being able to see the slides, something like that. Let me put this on. Here we go. Okay. All right. Think we're good. Does it look all right? Perfect. I
Looks
got
good.
thumbs up. All right. Wonderful. So, today, I am going to be talking about this concept of how caring adults are able to have, in some ways, I would say, the most meaningful impact on infants and toddlers and their mental health, right? Well being, quality of life overall, but also specifically mental health. I wanted to clarify that we're looking at how caring adults are involved in the impact they have, right? There are circumstances where adults that are providing care for children, particularly young children, maybe have some obstacles in their own lives to providing. Really loving or warm or responsive care, and that is a reality, and that's something we can talk about too. But we're going to talk specifically about the meaningful, lasting, lifelong impact that caring adults can have on the well-being of children in general, and also specifically for infants and toddlers. So to share a little bit more about myself, this is one of my favorite pictures that has ever been taken of me. It was very, very much candid, in case you can't tell. But I would say I have written permission from the friend of mine whose child this is to include this in the presentation, but for it not to be posted anywhere. So I would expect that everyone can kind of respect that and just enjoy looking at the smiles here. But something to know about me, maybe the first thing to know about me is that I love kids. I love working with infants and toddlers. I love working with preschoolers. I love my work as a play therapist and an infant toddler mental health therapist. I loved teaching when I was teaching. As you can see, I got my bachelor's in child development and family studies, which is an early education degree specializing in birth to five. Um, I actually loved teaching. I didn't leave teaching preschool because I burnt out or anything like that. It was something that I was very passionate about and I loved. And so I graduated with my bachelor's. I worked in a couple different settings, primarily in early education settings. Um, and then actually also moved to Normandy, France, and I taught there for a little bit, for about 2 years. I was teaching in two middle schools, actually. Their division of years or grades of school is a little bit different than ours, but I got to work with fifth through ninth graders in a couple different middle schools in France. Um, to teach English as a native speaker through an exchange program with the French government, which was wonderful. And a very different kind of experience in some ways, and very similar in others to teaching preschool, right? A lot of the same principles of providing care and responsive teaching in a classroom are pretty similar regardless of age. The only reason I left France, if I'm perfectly honest with everybody, is because I specifically wanted to be able to provide more therapeutic care to children who maybe weren't quite able to get all their needs met in a classroom setting with a preschool teacher, for example. In my own practice as a preschool teacher, I found that I really wanted to individualize my instruction and kind of differentiate the education that my students received. But as a teacher, I didn't have enough training, right, in mental health. That wasn't my field. And so I ended up going to UNC Charlotte to get my master's in clinical mental health counseling. As a part of that program, I was able to participate in the concentration in play therapy that UNCC offers. And then I have been doing play therapy from my internship all the way through today. It is what I plan to do long term. I really love child-centered play therapy. That's the approach to working with children that I specialize in. Along that path, as part of that journey, I also got my certification as a registered play therapist. That is, as you can see, a trademarked term. They are very specific about that because we want to, ensure that the public can trust that we have extensive training in play therapy. So I'll talk a little bit more about that in a moment, but these last two pieces are pretty much as important to me as the other ones, and I think they're worth mentioning. So the bullet point underneath that is that I am a very strong believer in the power of wonder. This is something that I have had the privilege of enjoying because of a lot of the roles and jobs that I have held. I have worked with children and families in some form or fashion for every job I have ever held, which I consider a great gift. But getting to observe the awe and the wonder that very young children have before the world and the hardships that come with life take it away from them is very precious. And I think it can be life-changing for us as adults too. And then along with being a play therapist, I also believe strongly in the importance of play for adults. Might look different person to person, but for me, I like being in community musicals. So that has been something that has allowed me to really enjoy the playfulness, the whimsy, the sense of humor that other people have, and hopefully that I maybe sometimes have, and get to enjoy being in a community in that way. Has been very, very joyful, very delightful, very enriching for me. So that has been something I've gotten into over the past couple years. And I would encourage all of you as grown adults to find what type of play really enriches your life. It does make a difference for mental health in general. So of course, feel free to ask any questions about that throughout the presentation. Happy to talk about it. But if we're kind of getting more into um, if we're going to get more into kind of the mental health piece of this with young children, right? I want to talk a little bit briefly about what play therapy is. So there is a common misperception, even amongst therapists, that play therapy just means playing something during a talk therapy session. That is definitely not what play therapy is. That is talk therapy while playing Monopoly or whatever other game. So I wanted to give you the specific definition from the Association for Play Therapy of play therapy. I know you all can read on your own, so I'm not going to read it out loud. But the general concept here is that play therapy is a full therapeutic orientation. So there are different types of play therapy. As I mentioned earlier, I practice child-centered play therapy. That is, I have not checked this within the past year, but I believe it's still true. That is the subtype of play therapy that has the broadest research background. We have about 35 years of research on the efficacy of child-centered play therapy, how it works, what presenting concerns. It really helps to support all of those sorts of things. Um, Play therapy is a way of approaching children. It's a way of shifting and shaping our language as therapists. It's a way of looking at nervous system regulation in the playroom. That's something that I specifically focus on, but is really different than you sit in this chair, I sit in this chair, and now I'm going to ask you all the questions. How is this going? How was school? How are you doing with all that anger? It's really different. And so I want to be clear about that. Play therapy is separate, and it is, in my certainly biased opinion, because I love play therapy, it is the most developmentally appropriate approach to therapeutic care for young children. Typically speaking, we would say that play therapy is appropriate for children from about 2.5 years of age, up through technically 12, although 12-year-olds today are a little bit different than 12-year-olds were, 35 years ago. If you think about the cultural context, right? Technology, all of that kind of stuff. So I typically say that child-centered play therapy is useful and developmentally appropriate for children from 2.5 to about 9 or 10. Um, that's kind of the general concept there. The Association for Play Therapy also likes to clarify that play therapy should only be provided by a mental health provider, right? A licensed mental health provider. And you need to have a lot of education that's specialized for working with children and for doing play therapy. So I am also a board member of the North Carolina Association for Play Therapy, so kind of the state branch underneath the Association for Play Therapy internationally. And um, that's, I would say, in case anyone is interested, or if there are any play therapists attending this call today or this session discussion, we are looking for new board members for the coming 3-year term. So just going to put that out there. But if you want to learn any more about play therapy in general, the Association for Play Therapy's website is a great option, a great place to start. So I believe that may have already been put in the chat, or I think Dr. Hopper's not gonna be able to do that. I'm sorry, I can't see the chat, but I'll leave that there. So um, when I talk about the fact that I do infant and toddler mental health support, this is the question that everyone has for me, right? So you just talk to babies about their feelings? You just talk to babies? Like what is infant and toddler mental health? No, I do not talk to babies about their feelings with an expectation of a response. I might name what it looks like they're feeling. Sure. I'm going to talk to their caregiver who's in the room with us, right? Because no baby grows up in a vacuum. No baby or toddler needs to be separate from their primary caregiver during a therapeutic session, right? Same thing applies for infant and toddler mental health that it would apply for like a pediatrician visit, PT, OT, any of those sorts of things, right? So I might talk to the caregiver about what infant or toddler is feeling, right? What they're showing us, what might they be communicating. But no, I do not just take a baby into a playroom and sit them down. We have a chat back and forth. Of course not, right? So when we're talking about infant and toddler mental health, we are talking about what is now called early relational health. This is the concept that well-being and health and growth overall for children comes from healthy and safe relationships. This is where that piece about having a caring adult comes in, right? So if we're looking at early relational health or infant and toddler mental health, we're looking for the capacity to have close and satisfying relationships, experience, manage, and express a range of emotions, and then to actively explore the environment and to learn, right? To gain new understanding or new insight about things. Um, to be able to explore, test out cause and effect, right? Learn that the jack in the box does pop up when you get to the end of turning that handle, right? Ooh, that's so startling. And then what happens? Toddler closes the thing again and does the handle and expects that the jack in the box is going to pop back up again, right? So all of these are really important pieces of early relational health, and that's largely what infant and toddler mental health is about. So if we're thinking about what are the pieces that need to be in place for healthy development for infants and toddlers, healthy development specifically of mental health, we're looking at relationships, right? Already mentioned that. We're looking at responsiveness. So when toddler or when infant cries, makes noises, moves around, right? Looks directly or in the direction of their primary caregiver, what happens? Is that adult able, generally speaking, not every single time the baby's looking for something, right? But generally speaking, are they able to respond? Right, that's a really important piece. We're also looking for respect in that relationship. So, if my toddler says no, it doesn't mean I don't do the thing they're saying no about, but am I able to kind of engage with that a little bit? Sometimes, can I give a little bit of an explanation about what's going to happen next, right? Or can I talk baby through what's going to happen with this diaper change? Or, okay, it is time to eat. I know you're so hungry. Okay, I'm going to get the bottle ready, right? You're talking through a respectful way of engaging with baby or toddler, right? Can you kind of respond? Can you have some respect for them as an individual person, even though they're little and tiny? They are kind of their own people, right? So you also want to look for routines in healthy development for infants and toddlers. So do they know what to expect? Do you have a bedtime routine? Is there a general plan for kind of how the days go? Those things are really important for providing a sense of security and safety for children. And then the last thing we want to look for, it's delightful because they all start with R's. The last thing we're looking for is repetition. So this kind of goes along with routines. This is the idea that children need a lot of exposures to kind of the same thing, the same idea, the same words, the same routine, the same, first we have bath time, then we put on jammies, then, mommy or mama or daddy or grandma or whoever's involved holds me and rocks me in the rocking chair, right? It's about the routine, but it's also in general about repetition, right? Kids need multiple exposures to new things to kind of acclimate or integrate that knowledge for themselves. All of these parts of healthy development, the social emotional health, this early relational health, they're all facilitated by adults, right? Infants and toddlers cannot do any of these things on their own, just biologically speaking. That's something that's good to kind of keep in mind. Oh goodness, here we go. Okay, all right, we got it. So I have a hot take for everybody here, and I know this is going to ruffle some feathers. All right, I know, I'm ready for it. My hot take is that there is no such thing as self-regulation or self-soothing for infants and toddlers. When I say that, I don't mean that baby doesn't learn to kind of fall asleep with the pacifier or that toddler, doesn't learn anything about taking a deep breath. Mommy's going to show you how to take a deep breath. We can do it together, but they don't self-regulate what they are doing. And I learned this, I will give credit. I learned this from Dr. Christy Opiola. She is taking over the play therapy certification program at UNC Charlotte. She's wonderful, so knowledgeable, so experienced. She told me this first in a class, or she taught this as part of a class that I was in with her, and it has stuck with me ever since. Infants and toddlers are not self-soothing or self-regulating. They are recalling experiences of co-regulation. So times when an adult has been there for them to help them calm. I should say when we're using the word regulation here, that's just kind of looking at how is the nervous system functioning, right? Are they able to kind of calm? Are they able to receive support and soothing and help from an adult, right? So children need coaching by a caring adult to model regulation, to guide regulation, right? Practicing together as infant turns into toddler, toddler turns into preschooler, um, to support developing self regulation skills over time. So, I imagine some of that might be a little bit nitpicky, right, or splitting hairs, but I do think this is important because assuming that there's something wrong with an infant or toddler because they cry a lot or they need extra support, they have maybe some big meltdowns, right? That we expect that at age 2. People call it the terrible twos. I love 2-year-olds. I think it's the terrific twos, right? But we're expecting some of that, but a lot of times people have I don't know, I would say the expectation that children start calming themselves down far earlier than is really developmentally expected. So I think this is an important thing for us to talk about. Um, Let me see. Okay. The other thing I would say, just for this concept, right, of regulation or the nervous system, what are caring adults doing for infants and toddlers, is as the adult in the situation, we have a responsibility to manage our own nervous system regulation so that we can, well, first of all, just because that's the goal and the growth of an adult, right, is for us to all manage kind of what am I feeling? What do I need? How can I access those things, right? That's just important in general, but also specifically, if we're thinking about early relational health, children need to see and experience their caregivers or the other caring adults in their lives um, as moving into regulation, right? As managing their own needs, as kind of being able to engage more readily in co regulation with the kiddo. I could talk about this for ages. I won't. We have a short time today, but there's a lot more you could find out about co regulation and how that works. I could literally talk for 2 hours on just that topic, but that's just kind of something to keep in mind as we're thinking about okay, what can we do to help support infant and toddler mental health? One thing that we can do is learn to practice our own regulation and learn how to effectively co regulate with little ones. So, this leads me very briefly to this image. So, this is from the Circle of Security International. This is a wonderful organization. They do a training for adults working with kids. That could be parents and other primary caregivers, teachers, therapists, right? Lots of us working with little kids. This kind of goes along with this idea of roots and wings. And I'll talk about that a little bit more specifically on the next slide. But this is the basic idea of co-regulation, right? So you can, again, I know you can read all these things for yourself. I'm not going to go over every part of it, but essentially what we want to see in infant and toddler mental health with these early interactions with a caring adult, they need us to support their exploration, right? That goes back to that idea of being able to learn from and explore the environment. Watch over them for protection, but also observe what they're doing, right? Delight in me. Help me when I run into some obstacles and enjoy this play or this exploration. The delight in me and the enjoy with me parts are of equal importance to the others, right? So watch over me, keep an eye on me, help me out if I get stuck, but also enjoy with me what's going on, how I'm growing and changing, what I'm doing. Right. And then when I come back to you, right, I need your help. I got scared. I got upset. I got injured, right? Any of those. I need you to comfort me, protect me, and help me make sense of my feelings. This is why self regulation as an adult and co regulation from adult to child are so important, right? I know it says at the top, parent attending to the child's needs. That is the largest piece of how this shows up. We want kids to have a secure attachment with their primary caregivers. But these concepts apply to any of us that interact or kind of work with young children, or any of us that work with primary caregivers, right? These are kind of the general concepts of co-regulation, typically speaking. So this quote, why did I call this presentation Roots and Wings? I did look for a long time of who the person who said this quote was or who wrote it. I could not find any consensus. So please let me know if you're like, I know the person who said this and you need to give them credit, right? I'm happy to do that. But there's this kind of this general concept, right? It's one of these, I don't know, phrases or sayings in parenting or in early childhood. If I could only give you two things, one would be roots and the other would be wings. If we're thinking about that circle of security image, and I'll go back to it, if we're thinking about that, that is what is depicted. Do you see those hands on the side, right? One says secure base and one says safe haven. These are the roots and wings. This is what kids need from their caring adults in order to be able to really develop healthy, positive, good mental health as infants and toddlers. So, again, very brief flyover view here, right? But secure base is the concept that if I am an infant or toddler, I can safely go out. That's what you see in the image, right? I can safely go out from my parent because I have had this experience. I know I can trust them. They've cared for me. They're responsive. They're respectful, right? I can leave them to go explore, to see something, right? To play with a toy, to meet another kid, to poke the nose of the dog, right? The pet dog in the house. I can go explore. So I have my roots, right? That's the secure base. And, oops, no. Uh, well, both actually. I would say secure base and safe haven are both roots and wings. So I have the wings because I can leave, right, safely with confidence from the secure base. And then when I need to come back, I also have roots of safety in a safe haven, that bottom hand, where now I need to come back and I know I can trust you for comfort, for care and protection to help me understand what's happening right now in this moment to make sense of my feelings. So, we're thinking about infant and toddler mental health. This is the pattern that we want to see, right? That kids have the roots, right? The safety, the security. I know I can come back. I've got roots in my family or whoever is in my close circle of safe and trusted adults. And I have the wings. I can go explore new things. I can learn. Um, I don't have to kind of stay right where I am. It's okay for me to leave a little bit and then come back because I trust that my caring adult is still going to be there to help me. So, roots and wings, right? That's kind of the general concept there. Oh, here we go. Okay. So, getting a little bit more into the brass tacks of infant and toddler mental health. What is it that would bring a family in for infant and toddler mental health support? Many different things. So, as you might expect, one of the first things that would bring someone in for this type of support or for a child under 3 to be receiving therapeutic support would be some variety of traumatic experience. So, those are things that you might think of right away, right? So, any history of abuse or neglect would certainly be a reason to maybe seek out some extra support for a very little one. Violence within the home, right? Aggression or violence, whether it is toward the infant or toddler or anyone else in the home, that's a good reason for kids to get some extra support. This would also include the loss of a primary caregiver. And when I say loss, of course, we think first of maybe death, right? But also, this could be maybe maybe someone is no longer able to be safe in the home with baby or toddler, right? That's also a loss. Even if the person hasn't died, often an infant or toddler will experience it that way. because those caring adults, right, or the primary caregivers and adults in an infant or toddler's life are the most important person, right? Those are the most important people, I should say. And even if there's a situation that is really not ideal or safe for an infant or toddler, losing one of those primary attachments is typically traumatic, right? And then another traumatic experience that might bring a little kiddo in would be something like a medical trauma, right? So if their birth was really traumatic, or there were kind of medical or physiological complications for them or for their birthing parent, something like a NICU stay can potentially be traumatic. And I want to, you know, the NICU is wonderful, does not mean anything about the type of care they received, right? But sometimes if it's a longer stay, right, or if the parents aren't able or caregivers aren't able to be present with the infant or toddler as often as they might like, sometimes that can be a little bit traumatic. Other things, concerns about development. So I'm worried my kiddo doesn't look at me when I call their name, right? They're not rolling over yet, right? What's going on? Of course, some of these things, yes, I would say go to the pediatrician first. Absolutely, right? That's a big important part of that early team, right? But also these are some things that will come into the playroom with me, right? We're not quite sure what's going on with development. Also, of course, concerns about behavior that's coming up or emotional expressions, right? So when we start to see things like tantrums that are lasting, more than I'd say maybe 30, 45 minutes on a regular basis, kiddo cannot be calmed down, right? Some of those things, or they're getting so upset, they're vomiting, right? It's hard to talk about, right? I don't want to, put too much out there. I know it's hard to talk about, but those are the sorts of things that also might benefit from some extra support from an infant and toddler mental health professional. Changes or challenges within the family unit, whoever that involves, or with this caregiver and child relationship. So sometimes, if a caregiver um, has a significant mental health concern of their own, it can impact their ability to kind of attach and connect with their infant or toddler. So they would be receiving, hopefully, mental health support of their own, right? But if they were concerned about the attachment or their bond, their understanding of their kiddo, that would also be a reason to get some extra infant toddler mental health support. Sometimes families come in, and this is general, not just to me, right? These are general reasons that people might see an infant toddler mental health professional. Sometimes people want just general caregiver support, right? In which case, if there are specifics about things they're noticing with their infant or toddler, then the infant or toddler would be the client, the identified client. If there's just kind of like, I didn't grow up around kids, I don't think my caregiver set a super great example, I want to do things a little differently, then I work with those adults separate from their kiddo for some of the time, and they're the identified client, right? So a little bit of nuance there, but either way. And then lastly, sometimes we get referrals from other professionals, right? So I have pediatricians in the area who will sometimes send families to me just to see, would this be helpful, right? Um, Teachers, sometimes preschool teachers or daycare teachers are the ones who identify, I think something's a little bit off. You might want to, see if you can get some help with this. So those are several of the reasons that people might come for support with an infant or toddler. Certainly not an exhaustive list, but that's mostly what I see. So I do also have permission to use this picture. I feel like that's important to say, right, in presentations. But this is a picture of myself and one of my students in one of the preschool classrooms that I worked in. The reason I put this here is because this is me in my element, right? I love working with kids. We had a baby doll circle time. It was just delightful. I love it. This is wonderful. The reason I put this picture up here is because I want to talk about, what do you need to work with infants and toddlers in general, and then especially with infant and toddler mental health, right? So I think the first thing that you need is delight. You need delight. You have to really love how special it is to work with very young children. You have to think, Man, what a great age for infants and for toddlers, right? We love to say that. Oh, how old's your kid? Oh, that's a great age. Right? You have to really believe that and feel that deeply, right? Oh, they're 5 months old. Oh, what a great age. Right? Oh, they're, 13 months. Oh man, what a great age. You really need that. That delight, that enjoyment. Um, it really lights me up to do the work that I do. And I hope, of course, that that's the same for all of you in your own contexts. But I think, particularly in working with infants and toddlers, you really need to love all those ages, all those stages, right? Certainly the challenges that come along with it, we can acknowledge those too. But that's the first thing I think is important. Secondly, I would say you really need to have a thorough understanding of child development. This is a really big deal for me, and I would say maybe a little bit of a soapbox, if we want to say that. I think it is so important for a therapist or someone else in the field, right? Other professionals working in infant, toddler, and early childhood, whether it's mental health, whether it's more along the lines of public health, right? Whether it is in teaching, any of that, you really need to understand child development and not just the flyby, like here's the developmental milestones checklist. You need to really deeply understand what is it that happens in all of these stages. Is this something to be pretty concerned about, or does this fall within the realm or the range of what is developmentally normal or typical, right? Kind of however, whatever language we want to use with that. An example that I would give is biting. Right. So a lot of times people are very concerned about biting, and rightfully so. Right. Of course, it causes injury. It's not a pro-social behavior, right? It can impact child to child relationships. Of course, there's a concern about health and safety, right? Especially if skin is broken, anything like that. And up through 5, fighting is developmentally typical. That doesn't mean it's desirable, right? I'm not saying it's not something to, address. There are things we can do to help support kids that are experiencing biting in their classrooms or they're biting at home. And it is still within the range of developmentally expected for 0 to 5-year-olds, right? Outside of that, maybe we start to wonder a little bit more what's going on, what extra support can we put in place. But you have to know that. You have to know about child development in order to be able to talk to caregivers about it and to talk to teaching teams about it. That's really important. So that's the second thing I would say. The third is you need a passion, not a tolerance, but a passion for working with caregivers. You cannot love working with babies, love working with toddlers, and not want to work with caregivers. It just will not work. It's going to set everyone up for a poor therapeutic experience. I feel pretty confident in saying that. You need to have skill in working with caregivers, and you can build that. That's not just an inherent either you're great at it or you're not, but there needs to be some training, some education, some experience about working with caregivers and family units. And you also need to like it and feel like it's really meaningful and important because you will burn out otherwise. And that is often what happens actually with play therapists is that they love working with kids. They don't really love working with caregivers, and it gets to be too much over time. That is often a cause for burnout or for people changing over to just working with adults or teens, something like that. The last thing I think you need if you want to work in infant and toddler mental health is a deep belief in children and in their capacity. Kids can do and learn and say and be so many things. And I think often we do them a disservice. Adults do not have a strong belief in the value of childhood, right? In the process of growth and development. And maybe we don't have a high enough belief in what children can do. I think that's really important for infant and toddler mental health, especially. Let's see. So overall, kind of wrapping up this conversation, what can all of us as caring adults do to support infant and toddler mental health? The first thing, as I said, right, is to really educate yourself on child development. There are some great courses. Now, I will say, I don't know if they are still I don't know if they are still free, but there's some great coursework online through the University of Maryland. I believe it's at Georgetown, but I shouldn't say that because I don't know for sure. But it's the University of Maryland, also through the Minding the Baby Institute at Yale University. They did some online trainings that were really good, very well rounded. Um, also, let's see, Association for the Advancement of Infant Mental Health is a national, maybe international, but definitely a national organization that provides trainings for professionals. You don't have to be a mental health therapist, but trainings on child development, working with families. What specifically do we do with care for infants and toddlers? So some great resources out there, right? But you do need to be well educated on child development to be able to support these families and their kiddos. Um, Make sure that you're thinking about what you or what we as a group can do to resource the caring adults, right? Because I might not have direct access to this kiddo myself, right? I might not be seeing them as a client, but what can I do to help provide more resources and more support for adults who care for children, especially really young children? And actually, I believe Cynthia's on the call today. Don't mean to call you out, but one of the wonderful things about Mind Body Baby, which is a local organization, is that they really talk about and focus on the fact that caring for the caregiver or the parent, depending on what the situation is, is caring for the child, right? So, whatever we can do to gather and educate people about resources that are available for those caring adults is help toward the kiddos. I think it's important to engage in advocacy on issues related to this population. So, of course, this has to do with education, right? It has to do with what cuts to the budget are being made in what areas, right? What are our tax dollars going toward? What are some rights that we believe children have that maybe aren't being respected in the way we would hope that they are? I won't say anything else too specific about that, but I think advocacy is really important. And then I would also say joining a local collective of professionals that support young children can be very helpful. So these are some examples. I am a part of both of these. I am sure there are other wonderful local organizations as well. But being with other professionals in collaboration also really makes a difference. So I do want to give a very specific and special thanks to these three individuals and then the Mecklenburg County Public Health Department. Some of the content, so for example, those 5 R's that I mentioned earlier, respect, responsiveness, those sorts of things, came from a specific presentation that these individuals and the public health department put together for a conference they presented at. I had sent an email asking, does anybody have some resources specifically that I might share in this presentation? Why remake the wheel, right? And so they were willing to share some of that with me, and I want to make sure to give them credit. So thank you very much to all of these individuals. All right. I'm like maybe a couple minutes over, but I'm ready for questions. I would love to hear from anybody if there are any questions that I could answer.
How do you advocate for play therapy as a profession, even if someone does not seek to become a play therapist? How do you encourage people to use therapeutic play when engaging with children?
What a lovely question. What a lovely question. Um, I think, to be honest, the first thing that comes to mind is have some materials. Again, I don't know what your particular individual context is, but what can be helpful is like having some materials about play therapy, right? So I will say the Association for Play Therapy will send you like they'll send it in the mail for free, a packet of like flyers on why play therapy, right? What is play therapy? What does it help with? Who might want to seek it out, right? So even whether you get those specific flyers or not, having some of those materials readily available, or even like here's some links, right? If you mostly work with families or in the community in a virtual way, Maybe you just have like, here's some links and you put them in your email signature, right? It doesn't have to be just play therapy, but like, hey, here's some resources for you for your young kiddos. And then I would say also learn a little bit yourself about what play therapy is, what it helps with, and why is it appropriate for children in a way that talk therapy is not. That can be a helpful thing. So even if you are not seeking to be a play therapist, those are some ways to kind of get more of the word out, right? Um, we also, the North Carolina Association of Play Therapy, we do some like outreach events in the community. Um, so, of course, feel free to kind of look into those and what's coming up. You can email me and ask about like, okay, can I send people to something? But that's a lovely question. That's a wonderful question. Mhm.
Thank you for that. Next question from the chat. How do you handle any challenges that may come up during play therapy? Maybe a child is struggling to understand certain techniques that you're trying to help them with. I think that might be a great question too. Like, how do you handle the challenges, and maybe how do families or parents also handle the challenges?
Yeah. So, this is something I think is particularly wonderful about child-centered play therapy. Um, the first thing is that I would clarify child-centered play therapy does not teach directly in sessions. I am sure that is a weird thing for many of you to hear, right? Well, then what are they doing in therapy, right? Why are you taking them? Um, it is most, what would we say? Let's see, research, as any of you who are in the therapy field probably know, research has shown us that the factor that weighs most heavily in whether clients make therapeutic progress or not is the quality of the therapeutic relationship. So, regardless of what specific approach you're using, if you are a cognitive behavioral therapist, if you are a person centered therapist, if you do dialectical behavioral therapy, right? Lots of different approaches. What matters most in clients experiencing therapeutic growth is the quality of their relationship with you. With that in mind, that is why child centered play therapy is so effective, because we prioritize the relationship as the therapeutic tool. The main kind of therapeutic change agent in the playroom is how am I interacting with this child, right? I have unconditional positive regard for this kiddo. That means I welcome you with delight. In my book, that's what it means. I welcome you with delight no matter what's going on, right? No matter how you show up. So, in terms of challenges in the playroom, challenges that I see are not based on I'm trying to teach a kid like a coping skill and they don't want to do it. Right. That's not a challenge that comes up for me. In some forms of therapy with children, that would be an issue. But challenges for me really go back to how can I continue to have that unconditional positive regard for this kid within myself? And also, what are they needing from a nervous system perspective, right? Is it that this type of play that they're doing is actually too dysregulating for them? They need a little bit of extra regulating or calming support? Is it that they're really bothered about the way that I'm not playing the way they wanted me to, right? I am not understanding what I'm supposed to be doing and they're really frustrated about it. I can handle that. Right? I'll say, "Oh, you didn't want me to, you didn't I'm looking at all the toys in my playroom. You didn't want me to get down that book. You wanted the other one." Yeah, I can get that. Right? Or, "Oh, you do not want me to talk." That's something that comes up sometimes. You want me to be quiet in the playroom. Oh, that's frustrating. And I might be quiet for like 30 seconds. Then I'm talking again because that's child-centered play therapy. Right? So those are some of the challenges that come up. I would say in a general sense, I would hope that other adults working with infants, toddlers, and young children would kind of use some of the same approaches, right? Like I'm looking to understand, and I being the general adult here, right? As an adult, I'm looking to kind of see if I can understand what's going on. I'm curious about what's going on underneath, right? It's not just the behavior, but what might be prompting it. So I go in with curiosity. I go in with a sense of collaboration, right? Kiddo, it is you and me looking at the problem together. It is not me against you, right? So a lot of it I would say is about mindset. I think that's true in play therapy. I think that's true in parenting, in teaching, in working with kids in general.
Thank you for that, both the question and your response. One final question for the conversation. We do ASQ, and I believe that's ages and stages questionnaire, social emotional exams at work. If a child receives a concerning score, would you recommend play therapy as part of their care plan?
Yes. That's the quick answer, right? So in some ways, it depends a little bit on age. So I think it's the ASQ through, is it 5 or 6, maybe something like that. Um, I just did one, but they're separated by month, like month intervals, basically. But yes, if there is a flag on the ASQ, that is a wonderful opportunity to refer for play therapy. Yes, mostly because the ages and stages is for those early years, right? What are we seeing? Oh, there's some developmental stuff, there's some behavioral stuff. Caregiver is reporting that they're not seeing this, they're not seeing this, or wow, there's a lot of this and it's really troubling for the family. Right. So, absolutely, that's a great reason to refer for play therapy. And that's true, even if they are an infant or toddler. You just need to find someone who specializes in infant and toddler mental health because, as I mentioned earlier, child centered play therapy, research wise, is intended for children 2.5 and up. However, children under 2.5 still need and deserve mental health support. And that's why you want to look for someone who has additional expertise and training and, I don't know, supervision. Actually, I had a specific infant and toddler mental health supervisor because I wanted to have someone who was really skilled in that because it was important to me to gain more expertise and knowledge about it. And it is different than just standard child-centered play therapy. Um, it's a lot more focused on the interactions between the caregiver and the kiddo. It's a lot more about caregiver coaching in the moment, right? Oh, I see babies looking away. It seems like maybe that's a little loud for them, right? Or, oh, they need a break. Okay, we're going to pull back just a little bit. You stay right in their field of vision, right? We talk about all that kind of stuff. It is different than play therapy, but being a play therapist helps a lot with working with infants and toddlers.
If this piqued your interest in any way, I know we have students who are looking for opportunities to learn more about specific professions or look for internship opportunities. Can they reach out to you directly or through
Yes, and I
me?
was I was gonna say that was my last slide was just my name, my email, and my phone
Ah,
number.
okay.
So yes, please feel free. Yeah.
We will share that. Well, thank you so much. Again, if this piqued your interest, we are working on developing our April crucial conversation. You can use the QR code on this slide. Maybe this piqued your interest about some possible research that we could help facilitate or any of the above, right? Finally, last thing I'll share is I want to thank Ellen for being here today. I know that there will be additional opportunity. We're working on an April event for a public health grand rounds to really focus in on early relational health even more. So stay tuned for more information on that. I want to thank you all for joining us. I shared a few flyers on this slide and we'll put some details in the chat. The work group is helping to facilitate a respectful maternity care simulator on April the 11th. And we're also helping our caring partners to promote their second annual maternal health conference that's happening April 17th. Some of that flyer is cut off, but check out the chat for more information. Again, I want to thank you all for being here today and just encourage you to stay connected with the Charlotte Maternal and Child Health Work Group. Thanks, everyone.